Welcome back to Uncharted Waters with Admiral Waters. I'm your co-host, Lieutenant Commander Kenneth Bradley. Lock in with us as we have a conversation about mission and mindset pertaining to all things Navy recruiting. Don't forget to like, share, and subscribe. And share it with everyone. Send it to your mom, send it to your dad, send it to yourself and watch it 50 billion times. All right, let's get into the conversation. And today we are joined with Chief Medical Officer, Dr. Velvie Pogue of Memphis MEPS. Dr. Pogue, you mind telling us a little bit about yourself?
Yes, well, thank you for having me. I've been here for almost 10 years as a Chief Medical Officer. Before that, I lived and worked in New York City. I did my medical school in Boston, and then I moved to New York where I did my residency and my fellowship. And I stayed on at the same hospital, actually, and worked as a kidney specialist there. I was involved in training medical students, training house staff, and taking care of patients, especially patients with kidney disease. So I've been here for about 10 years after retiring from there. And as I told the commander, the admiral, I had a wonderful time here so far.
Yeah, well,
I've
thank you
enjoyed it.
so much for taking the time to be with us today. And thank you for your continued service in helping people and in particular helping our Navy. So thank you.
Yes. Well, we've enjoyed it very much. Thank you.
Yeah.
Thank you. And with that, we're going to dive right into a great conversation today. Dr. Pogue, can you briefly explain your role as the Chief Medical Officer here at Memphis MEPS?
Okay, well, I have a couple of jobs to do as the Chief Medical Officer. I am actually involved in the taking care of the medical section, all of the different aspects of the medical section. So I am involved in the applicant evaluation. So I function as a provider to evaluate the applicants, but I'm also the supervisor of the other providers. So I make sure that everything that is done per protocol, per the regulations. So that's, I guess, for me, my number one job. But I'm also the supervisor of the laboratory. So I'm responsible for making sure that all of the procedures that are done correctly and done in accordance with regulations. That includes the eye testing, the vision testing, all of the other aspect of it, the HIV drawing, the drug testing. And heaven forbid, if there's a medical emergency in the medical sections, then I respond to that as well. So that's pretty much what I do.
Yeah, that's all.
That's it.
That's a pretty big responsibility.
Yeah.
And I just want to highlight for the recruiters out there, this is a unique opportunity to really hear from, sort of the leading edge, the front edge of what happens here at MEPS and sort of a peek behind the curtain a little bit. There's nothing really mysterious, but I'm sure for many recruiters, this is an area that you don't really know. You experienced it once yourself when you went through, but it's been a while. And I think, I have personally been very impressed with not just Dr. Pogue, but the other chief medical officers I've met around the country as I try to visit a MEPS wherever I am. And I just think it's really inspiring, your story of, after retiring from a career in New York City to come here and continue to work for 10 years. And with all that responsibility, I think it'll really open the eyes of a lot of recruiters out there.
Thank you.
Yeah.
All right, another question for you, Doc. Can you walk us through what happens to an applicant from the moment they step into the MEPS medical section until they leave?
Okay. When they come to the MEPS medical section, the first thing we do is confirm that they are who they're supposed to be. So they have their ID, they have to be a legitimate ID, and at the check-in station, which is, so the first place they go to, that's checked to make sure that's correct. After that, they are provided with the labels for their various tests. And they keep those, they have some information on them, so we make sure they are aware that they're responsible for making sure that that stays with them exclusively. They do not put it down and walk off. So after they do that, then they go to the different stations. One of the stations will be just something very straightforward, having your height, weight, vital signs done. The other sections that they might go to, and it's not in any particular order, would be the vision testing and the hearing testing.
And in the vision testing, does that include depth perception?
That includes depth perception for those who are to have it.
Ah,
It is not part of the routine evaluation at the MEPS, because at the MEPS we evaluate, as you know, for every different branch of the service, and not
Yes.
every service wants that or requires that. So we
Right.
do it for those services that require it, but it's not part of the routine.
Okay.
After that, they go to the briefing, the command briefing first, and then the medical briefing. And basically, both of those briefing tells them that this is what you do, this is how it works, this is what you need to know, just that kind of stuff. So it's an educational forum for them to make sure that they understand what's going on. Once they finish the briefing, then they have specific tests done. They have tests that could not have been done before the briefing, because the briefing is basically where we confirm that they've actually provided informed consent for procedures that require informed consent. So procedures that require informed consent will be the HIV testing, the drug testing, and the breathalyzer, the blood alcohol. So those are the testing that cannot be done before they have the briefing.
Okay.
Okay. So they go after they finish the briefing, they go get those tests done. When they finish those tests, then they go and basically sit in front of the television and wait for the doctor, the provider, to call them into the room for their medical history, their physical examination, and at some point in between that, they would have their neuromuscular evaluation, which used to be the orthoneuro, which used to be that dreaded duck walk that everybody knows about.
I was gonna bring that up.
Yeah,
But there is still a duck walk or no?
there is sort of a duck walk. They say it's a duck walk, but if you did the duck walk, I'm sure it's nothing like what you did.
Right.
It's very, very abbreviated, so to
Yeah.
speak.
And you're just making sure people have a reasonable balance
Yes.
and everything moves
Yeah,
the
we're
same.
not really into proving that you're strong enough to do something. That's the job of the military.
Right.
We just want to make sure that there are no, serious issues related
That's
to it.
right. And when you say medical history, there's a review of that happens before the candidate gets to you.
Yes.
But for the recruiters out there, this is the go look in Genesis at the Health Information Exchange, what's available, correct? Are you looking in that extensive record before they get there?
Well, yes and no. Okay. So the way the process works is they fill out that form that you were mentioning, the questionnaire.
Mm-hmm.
It's called a pre-screen. It's 2807-2.
Yes.
Now, that has 112 questions about the medical history on it. That's where, to be perfectly honest, we really, really, really depend on our partners, our teammates, the recruiters. They fill out that form with the applicant, and we depend on, absolutely hope that when they fill that form out with the applicant, they make sure the applicant does it completely and accurately, because this is where everything starts. So that form, yes. Now, as far as the Genesis, so after they fill that form out and it goes through even, HRA, and it finally gets to us, we review that. Now, there are two options. One, if they have very little information on there and there's very little information in Genesis, then they're just automatically authorized to come in. On the other hand, if there is more information that, should take more time to review, then that comes to us to review before they are authorized to come in.
Okay.
But everyone gets authorized to come in, but not everyone gets done automatically to start.
Right. Okay.
So,
Okay. And you spend some time in that record ahead of candidates. So your daily routine is you see patients or you
yes,
see candidates, but you're also looking at medical records.
yes, absolutely.
Yeah. It's a big
And
job.
it takes a lot of time to review some of them, and some of them are very straightforward. But some of them have hundreds of medical information, so that may take a little more time.
Yes.
But the expectation is that we would finish all of them within 5 days, and many of them it doesn't take but an hour or two. So
Yeah.
it depends.
Okay. Really good.
Mhm.
Awesome. What are the biggest myths or misconceptions applicants or even recruiters have about MEPS Medical?
Hmm. That's a hard one, especially since I don't spend too much time with the recruiters.
Okay.
So what I'm going to say is sort of based on what the applicants tell me the recruiters have said.
Okay. No, that's great.
Yes.
Getting that perspective to recruiters is perfect.
Okay, so our official position is we are a team. Okay. We are a team
Yes.
and we work as a team. And we expect the recruiters to be a major part of the team for us.
Mm-hmm.
Okay. Since we're on the same team, we really have the same goal. And our goal, despite what rumor has it, is that everybody we want to get to yes. We do not want to disqualify applicants. It is not our job to disqualify. It is not what we want to do. I mean, when I've finished an applicant and they're qualified, I'd say, congratulations. They smile and say, thank you. How to beat that?
Right.
So it's wonderful.
That's a great day.
But we also have another responsibility. And that's to make sure that when those applicants leave, we have completely evaluated them and we have adequately reviewed any medical issue that is currently present or has ever been present. Because we do not want them to, number one, go to basic training, find out they had a disqualifying condition, and they don't have a waiver for it. Or they go somewhere and something really bad happens and it's something that we should have picked up at the MEPS. So we don't want to say no, we don't want to disqualify anybody, but we still need to make sure that, we have done our due diligence as far as making sure that when they go, everything that should have been found has been found and all issues have been addressed.
Yeah.
So, I think the little part about them thinking that, we really want to disqualify everybody, that's probably completely not true.
Yeah, that's a great point that I want recruiters to think about. It's great that they heard your words from me to the recruiters. It is something I believe wholeheartedly that every chief medical officer I've met, and you were the first, I think,
Maybe.
that I met in this job, has this attitude that they're seeking to get, to get to yes, but they have that responsibility that we all understand to identify when something doesn't meet the standard. And you do that job professionally and with care for the individuals
Yeah.
and for the military in general.
Yes.
Yeah.
I think we all take it very seriously.
Yeah, yeah. And so for the recruiters, this isn't like a game of how do we sneak somebody by. It's, hey, we're sending what we think are our best to MEPS, and sometimes recruiters are not doctors, they're not medical technicians. You don't have access to the medical record. Sometimes we find things that are like, well, we can't go forward with this. And that's how it happens, and that will come to us for a waiver consideration. For the most part, there's some that aren't
Yes.
allowed to be waived or even processed, but generally it'll come to us, and then there's a decision on a waiver or not.
Yeah.
Right.
Hmm.
So I think it's a really fair process and a great check and balance on everything, because the medical records are complicated. Like our record, I think, from my N33 shop, the medical waiver shop, is something like 1,400 pages, right? 600 isn't uncommon in the world of medical waivers. So you have a big job.
Yeah.
I know. Yeah.
I think the other thing that they may have confusion about, and this is truly based on what the applicants tell me, is that if something is no longer a medical issue, if it's resolved, uh, if it happened a long time ago, then they don't have to say yes to that on the questionnaire. And they said, oh, I don't have to say anything about that. No, that's not necessary because it's not a problem anymore, or my doctor cleared me or something like that. But really, all of those questions go back to the day that they were born. And so the recruiter really needs to make sure that they answer those questions. Yes, even if it was a minor issue, even
Right.
if it's resolved.
Yeah, and trust that the judgment and the rules will adjudicate it
Yes.
properly. Those things that are truly past the statute of limitations, if you will,
Yeah.
you'll continue to process.
Yeah.
And many of those things, even if not, they'll come to us for consideration,
Yeah.
and common sense and appropriate medical risk will be
Yeah.
assessed.
I think the other thing about that is that even if it's clearly minor, if they say yes to it, it may make a little, light go off in the applicant says, they may ask me about that. I may need to get some more information. I may talk to my mother and find out what that was all about. So, even something like that may just lead to the
Yeah.
applicant being a little more knowledgeable, just thinking about it, and therefore maybe talking to someone. I'm not sending them for records. Definitely not. But they may want to just talk to their parent, because many times they show up at the MEPS and I say, oh, why this, why that? And they say, oh, well, I don't know. My mother told me. So what did she tell? I don't remember exactly. So, if they actually start thinking about it and realize maybe I should just have a little more information about this, just in case they ask me about it when I go to the MEPS.
Yeah.
So I think that may help some too, that, they answer those questions, correctly, even though it may appear like it's not a big deal.
Yeah, that's really
And-
good. Really smart. Okay. Thanks, Doc.
Really good points. Heard that, Recruiting Nation? Honor, courage, and commitment. Back to the day you were born. Trust the process. I like that. That stuck out.
Okay.
Dr. Pogue, what are the most frequent reasons applicants get medically disqualified at MEPS?
Okay. Well, I would suspect that there's some slight regional variation,
Yeah.
but I think overall they're probably pretty common. So the most common would be some behavioral health related issue. I mean, that's really what we're seeing now. So depression, anxieties, suicidal ideation, self-harm. These are, fairly common now. There's also ADHD, which comes under that, though it's not quite, we feel a little differently about that, but that's another one. So those are pretty much the major ones. I'm sorry, the most common ones, the number one one.
Yeah.
And after that, we would have vision, which is pretty common. So vision is a big one. And then after that, some of the more, routine medical issues, asthma, anemia, eczema.
Yeah, eczema is one that I hadn't really thought about before I got into this job and really dug in here. But there are, it's not just, oh, I have an itchy spot on my skin. This leads to like open lesions and things like
Yeah,
that
okay.
that you can't really have at boot camp.
Mhm.
And then many times this is being treated with injectable medications, which we can't accept
Yeah,
at boot camp as well.
yeah. So those are the pretty common ones. Shoulder dislocation is a big one. Well, dislocation of any major joint actually is disqualifying.
Right, which would come to us for assessment
Of
of
course,
a
and-
waiver. And just so the recruiters understand, something that was dislocated a while ago and then they've continued to function normally we can work through that, I
Yes.
think, generally. But if you have frequent dislocations,
Mhm.
that speaks to the instability and inability to
Yeah.
perform tasks in the military.
Yeah. Now, for my perspective as someone who's just deciding yes or no disqualified, the most important thing is for them to actually say yes. Because if they say no and we don't know, and they go to basic training, and then of course it's going to be found out, then they're there without the waiver that you could have given them.
Right.
You
And
know.
then they'll get sent home. That's a
Yeah.
great point. I love that. Right. So for recruiters, we're putting people, their careers and their opportunity at risk if they don't trust the process, right?
Mhm.
Trust, because I think you made a great point. Just to be clear for recruiters, the MEPS job is to really look at what does the DoD instructions say the requirement is, and do they meet that requirement?
Yes.
If they don't, it's a condition considered disqualifying, and that would then get sent to the service
Yeah.
for an assessment for a waiver. to your point, if none of us catch any of that and they just kind of keep it to themselves and it comes out, because it almost always does,
Yes, it will.
right? There's no waiver. There's no assessment. Then they're likely to get sent home, right? If they come in with a waiver, then there's more of an opportunity to be retained.
Yeah. Okay.
Yeah, that's good.
And last question or proposal to you, Dr. Pogue, if you will. If you could leave recruiters with one message about the MEPS medical process, what would that be?
That's a difficult one.
Ooh. I can't take credit for that question. Also, PAOT.
Okay, well, I would leave them with this one that, of course, is going to have about 5 or 6 different components to it. But yes, so the whole idea that the pre-screen is where it starts. So make sure the pre-screen is done and it's done well. When they come to the MEPS, there are a couple of things they need to think about that they probably don't even think about. So, well, fingernails. No colored nail polish. We have to be able to see under the fingernails. So let them know that. Underwear.
Wear underwear.
Wear underwear.
Who knew that we'd have to include that in an Uncharted Waters podcast? But here we are.
Here we are.
And you say it because it
happens a lot.
It happens a lot.
And the other one would be piercings. At one point in time, you said piercing, people thought you meant ears. Now they're piercing.
Everything's pierced.
Everything is pierced. And you cannot come in with those earrings on. So you have to remove those piercings before you come in. We cannot help you. You have to do it. And if you have, rings where in positions, you have to remove them or you will not be able to finish processing. So just be aware they need to remove those earrings.
Yeah. Right.
So
I think another one that I've heard, you can validate or not, is a letter from an orthodontist relative to braces. They have to be coming off before they ship. Isn't that right?
You are stealing my thunder.
Oh. I am sorry.
You are stealing my thunder.
I'm sorry. Keep going then.
Okay, so as you know, we do not ask the applicants to provide medical documents now. I mean, we have all of these databases that have a lot of information, and we really expect and probably will find most of the information that we know as far as medical documents there. But there are certain things that will not be there. And those certain things might ruin the process for the applicant. So speaking of braces letters, if they don't have a braces letter, they are going to be either disqualified for not having it or open for it, not completed. So that person will not be able to be, quote, qualified on the day that they come in without that braces letter.
That just says when they're going to have them removed.
That little letter, that one, 2 little sentences. So that is actually one of the things that they can and the recruiter should include with the pre-screen.
That's a great idea.
That's an important thing for the recruiter to include with the pre-screen. Always have that there. The other thing is, if they've had LASIK surgery, we're probably not going to have the pre and post documents related to the LASIK surgery that say whether or not they had a disqualifying condition before. If they had a disqualifying condition, eye condition before, they'll still be disqualified. Okay? And if we don't have the documents, then we may wind up disqualified. Well, the regulation says disqualify them because we can't say that they didn't have disqualifying eye lesion beforehand. So there's a sheet, there is a checklist that the recruiter has or should has that they give to the applicant, and the applicant takes this to their doctor, and their doctor fills it out with all of the, their eye findings before and after surgery, showing that the vision is stable and that they did not have a disqualification beforehand. So they need to have that. Otherwise, it slows down the process. So that's something that the recruiter, needs to do.
Right.
And let's see, there's one more. ADHD, very common. We'll find documents, we'll find medical records and stuff. We will not find a transcript. We will not find anything about whether they have an IEP. We will not find anything about whether or not they have a 504 plan. So that information the recruiter can include with the pre-screen. Now, the regular medical documents, we don't ask for that. But those would really, really, really speed up the process and keep them from not being able to finish because they don't have that question asked.
When you said IEP, do you know?
So some it's basically accommodations for someone who has ADHD or
disability education plans.
So
Yeah,
if there was
education.
like some kind of accommodation required in order for them to complete their education.
Yes, if they had this, then it would be something that, well, to be honest, if they've had one within the last 12 months, then that would be something that would make ADHD disqualifying. Okay, and they would need a waiver for that. So if they've had an IEP, and the 504 plan would be like accommodation, like more time taking exams or taking the exams by themselves so they don't get disqualified. So these are accommodations that the school, the program may have
Yes, I got
to help them. So that's not going to be in, Genesis. But that's something that if they had it, then we would need to have that as part of their evaluation. So if they had one, and they don't have to have a letter saying I didn't have one, just if they did, then they should have the school provide that for them. And then that would not slow down the process.
Right. Okay. Really good.
And that's from the recruiter. So that's something that the recruiter needs to know so that they can provide it.
Yeah, thanks.
Yeah.
That's really good.
Absolutely awesome. Sir, any closing remarks before we close up the conversation?
Yeah, thanks, Doctor. It's been a real pleasure having a conversation with you today. When we met a number of months ago, back in probably April or so of 24, I was really impressed with the way that you cared about this work, and it's come out in this conversation as well. So I'm really grateful that you took the time in your busy schedule to sit down for 20-25 minutes or so and talk with us today. And it will help Navy recruiting because the recruiters will hear directly from you.
Well, it's my pleasure.
Yeah.
Thank you.
Yeah, thank you.
Okay.
Ken?
With that being said, I'm going to leave you with this acronym, TTRBAW. MEPS Medical is on your team. Trust the process. Remove piercings, braces letter ADHD, and wear underwear. Don't forget to like, subscribe, and share with everyone. And Dr. Pogue, thank you for joining us on Uncharted Waters today. You all have a nice day.